Senator Gazelka.
I move that further proceedings under the roll call be dispensed with and the Sergeant of Arms be instructed to bring in the absentee members.
On that motion, all in favor say aye. Opposed say no. The motion prevails and the Sergeant at Arms will bring in the absent members. Members, please stand for the prayer. Today's chaplain is Reverend Matt Hauskin from Cross of Calvary Church in Olivia, Minnesota. And following the prayer, please remain standing for the Pledge of Allegiance.
Let us pray. Gracious Heavenly Father, I give you thanks for this wonderful group assembled here today that you have entrusted with the noble task of making decisions for our great state of Minnesota. So many times their contributions are overlooked, and under the microscope of criticism, things can be weary. But draw us all to the simple fact that we serve you and those you have entrusted us with. I ask that as we move forward with discernment today, may you bless that discernment. May we discover ourselves, even if we're on opposite sides, as friends and brothers and sisters, knowing that you stand in the midst of us. You hold us all together. The diversity that we have, the diversity that we represent, you are a God who holds us together and creates out of crisis, creates out of conflict. Keep us always mindful of this. May we know and may we be able to hear your still small voice speaking within us each and every day. And it's in your name we pray. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
The Secretary will take the roll.
Senators Abler, Anderson B., Anderson P., Bach, Benson, Bigham, Carlson, Chamberlain, Champion, Clausen, Cohen, Swazinski, Dames, Dibble, Draheim, Dietzick, Eaton, Eichhorn, Eaton, Eakin, Franzen, Friends, Gazelka, Goggin, Hall, Herr, Hayden, Hoffman, Housley, Howe, Ingebrigtsen, Isaacson, Jasinski, Jensen, Johnson, Kent, Kiffmeyer, Klein, Coran, Lane, Lang, Latz, Limmer, Little, Marty, Matthews, Miller, Nelson, Newman, Newton, Osmic, Pappas, Pratt, Rarick, Ralph, Rest, Rosen, Rude, Senjum, Simonson, Sparks, Tomasoni, Torres, Ray, Utke, Weber, Westrom, Uyghur, Wickland.
A quorum is present. Members, we will begin on the agenda today with the fifth order of business, reports of committee. Senator Gazelka.
Mr. President, I move the committee reports printed in the agenda be adopted.
On the adoption of the committee reports, all those in favor say aye. Opposed say no. Motion prevails. We will move to the seventh order of business, second reading of House bills. The Secretary will read the House file numbers.
House file numbers 495, 2265, and 2276.
Second reading. We will move to the eighth order of business, introduction and first reading of Senate bills. Members listed in today's introduction calendar are Senate files 2785 through 2797. These Senate files will be given their first reading and referred as indicated. Moving to the ninth order of business, motions and resolutions. There are several authors' motions listed in the agenda. We'll take these authors' motions as one motion. All in favor say aye. Opposed say no. Motion prevails. Continuing under motions and resolutions, Senator Pappas.
Mr. President, I'm sorry, I don't know what this is. Could you hold it until a little bit later?
Sure, we will hold
Thanks.
it until a little bit later. Remaining under motions and resolutions, Senator Gazelka.
Mr. President, pursuant to Rule 26, I designate the following bills to be made for special orders for immediate consideration. Members, the sheet is on your desk. There's 7 bills there.
Members, the first bill for consideration is number 131 on general orders, Senate File 278. Senator Jensen.
Thank you, Mr. President. Thank you. Today I present Senate File 278, a bill on pharmacy benefit manager. I would like to thank my co-authors, Senator Dames, Senator Wickland, Senator Draheim, and Senator Benson. Briefly, I would say thank you to so many of the members that have already looked this bill over and contributed to its present shape. I would like to say thank you to the stakeholders as well. This bill creates a new structure to regulate a previously unregulated industry called pharmacy benefit managers. The acronym would be PBM, and you'll hear me use that during the course of the discussion today. Initially, PBMs were created in the late 1960s to process prescriptions. Over time, as Medicare and medical assistance became federal realities, PBMs were asked to do more and more. They started to create formularies for their plan sponsors typically being large employers or insurance companies. So now the PBMs were in the business of creating formularies as to what drugs would be allowed to be used for those patients and which ones wouldn't. Over time, with the advent of HMOs, things grew more intense and more efforts to save dollars took place. PBMs moved into a tiering process for medications and ultimately had frank negotiations as to whether or not a specific prescription drug would be allowed to be used on that formulary. Over time, mechanisms to woo the PBM to put their drug on the formulary by the manufacturer would take place, and so we had the advent of rebates. Over time, various mechanisms to retrieve or claw back dollars from local pharmacies to the PBMs took place, and I won't bore you on the details unless you ask. So in a world filled with rebates and assessment fees and clawback mechanisms, we saw the advent of spread pricing, where the plan sponsor would be charged one price by the PBM, but the pharmacy would be reimbursed a lower price. And so spread pricing has contributed mightily to the $1 billion of profit. We've tried to work hard with the stakeholders on this bill and had at least 50 to 75 meetings. Essentially, the bill provides a licensure mechanism, it permits Chapter 62W to be cited as the Minnesota Pharmacy Benefit Manager License and Regulation Act. It defines a multitude of terms. It requires the PBM to exercise good faith and fair dealing in the performance of its contractual duties. It requires the PBM to provide an adequate and accessible pharmacy network. It establishes transparency requirements. It requires PBMs that have ownership interests to be more transparent than ever. It prohibits a PBM from requiring a pharmacy to dispense a therapeutically equivalent alternative drug that costs the enrollee more. It requires PBMs with specialty pharmacy ownership to disclose such ownership. It requires preferred pharmacy networks to disclose to the enrollee upon request the out-of-pocket cost. It allows for a synchronization event to occur once a year without cost to the local pharmacy or to the patient. It allows pharmacies to substitute a bioequivalent medication in situations where there's an urgency and the prescribing physician is not available. Mr. President, I think at this point in time, I will truncate my comments, and I do believe there's an amendment.
Senator Jensen, you have an amendment, or another member has an amendment?
Another member has the amendment.
Members, any further discussion on Senate File 278? Senator Wickland.
Thank you, Mr. President. I actually have a couple amendments. First, I'd like to offer the A25.
Senator Wickland offers the A25 amendment. The Secretary will report the Wickland amendment.
Senator Wickland moves to amend Senate File Number 278 as follows: page 1, after line 8, insert. This is the A25 amendment.
To the amendment, Senator Wickland.
Thank you, Mr. President. This amendment has to do with prescription drugs and ensuring that patients have access to prescriptions, even in the case where they may have a prescription that has ended and they need to get a refill from their provider. This would allow pharmacists to fill prescriptions in emergency situations. We require the insurance companies to pay for this refill, and it would provide strict standards for pharmacists to follow in order to fill this prescription that needs a refill from the prescriber. They would need to have a relationship with the pharmacy. They would need to be sure that the patient has been compliant with taking the medication. The pharmacist would have needed to try and contact the practitioner and been unsuccessful. And one of the most important things about this is that the drug would be something that's essential to sustain the life of the patient or to continue therapy for a chronic condition. And failure to dispense the drug to the patient would result in harm to the health of the patient. The drug could not be a controlled substance, except for some specific seizure medications. If these conditions are met, it would allow the pharmacist to dispense a prescription not exceeding a 30-day supply, and it would only be possible to fill this in one time in a 12-month period. The pharmacist would be required to notify the practitioner not more than 72 hours after the drug is sold or dispensed. The reason I'm bringing this forward is that there have been cases across the country where patients have needed to access an insulin prescription. They've gone to get a refill, found that it's out of date, and they haven't been able to contact the provider in a timely way to get the prescription refilled. And so this would allow the pharmacist to use their judgment in cases like this so that they don't become a life-threatening situation to someone who needs insulin for everyday use. And it's one that I think Senator Jensen is familiar with the language, and I hope he would take this as a friendly amendment to his bill.
Further discussion on the A25 amendment, Senator Jensen.
Thank you, Mr. President, and thank you, Senator Wickland, for offering these thoughtful considerations. I would oppose this amendment for the simple reason that this language that you're proposing here has already been amended onto Senate File 1098. And I think in regards to the thrust of this bill, much of what you're trying to provide coverage for, which I would agree with completely, but this is already in a different bill, and the pharmacy benefit manager bill per se doesn't really, if you will, intrude into that aspect of business. So I appreciate the thoughts. I agree with the essential message, but this is in Senate File 1098 already, and that is Senator Rosen's bill. I oppose the amendment.
Further discussion on the amendment, Senator Rosen.
Thank you, Mr. President. Yes, and thank you, Senator Wickland, for this amendment. It is, as Senator Jensen said, in the Drug Price Transparency Act, and that is moving along. In fact, that bill is in front of Judiciary, Senate File 1098, and so I would, that bill is expected to come to the floor. It's a good, clean bill, and I'm sure everybody's anxious to vote for that bill once we get it here.
Further discussion, Senator Wickland.
Thank you, Mr. President. Yes, I know that the bill, or that this language is in that bill. I was a little concerned, though, since it hadn't had the hearing in Judiciary, if that's going to be possible. Senator Rosen, does it have a scheduled time frame to be heard in Judiciary now that we are past second deadline? And will it be moved to general orders from Judiciary? If she would yield to a question.
Senator Rosen will yield. Senator Rosen.
Thank you, Mr. President. And Senator Wickland, very good question. I know this is going to have to go to rules, Senate File 1098. But yes, there is talking with the chair of Judiciary. We're moving along. In fact, we just worked on it this morning, and your language is safe and sound in that bill.
Senator Wickland.
Thank you. Thank you, Mr. President. Thank you, Senator Rosen. I guess with that assurance, I would like to see this definitely move forward this session, and I will take it into consideration that you have that scheduled and will be getting that bill, Senate File 1098, moved to the floor. So I will withdraw my amendment. Thank you.
Senator Wickland withdraws the A25 amendment. Further discussion on Senate File 278, Senator Kiffmeyer.
Thank you, Mr. President. And Mr. President, I offer the A21 amendment.
Senator Kiffmeyer offers the A21 amendment. The Secretary will report the Kiffmeyer amendment.
Senator Kiffmeyer moves to amend Senate File number 278 as follows, page 17 after line 21, insert. This is the A21 amendment.
To your amendment, Senator Kiffmeyer.
Thank you, Mr. President and members. This is some clarifying language for rulemaking that is important to be in this bill, and my understanding it is agreed to by Senator Jensen as well. Thank you.
Discussion on the amendment, Senator Jensen.
Thank you, Mr. President. Thank you, Senator Kiffmeyer. It is exactly the kind of input that Senator Kiffmeyer has provided to this bill that gives a bill that goes from start to finish a better shape. And so I think this bill, this amendment does exactly what we want it to do. It tightens up rulemaking and puts into statute as much as we can, and I thank her for it. I would see this as a friendly amendment, and I will support it. Thank you.
Any further discussion on the Kiffmeyer amendment? Seeing none, all those in favor of the amendment say aye. Opposed say no. The motion prevails. The amendment is adopted. Further discussion to the bill, Senator Benson. No? Any further discussion on Senate File 278? Senator Wickland.
Thank you, Mr. President. Excuse me, and I do have another amendment. And this one is not language that's been moved in another bill, so I would like to have a chance to present it here. It's the A23 amendment.
Senator Wickland offers the A23 amendment. The Secretary will report the amendment.
Senator Wickland moves to amend Senate File number 278 as follows, page 17 after line 21, insert. This is the A23 amendment.
To your amendment, Senator Wickland.
Thank you, Mr. President. With the cost of insulin nearly doubling over a recent 4-year period and little action taking place at the federal level, it's really vitally important that Minnesota put forward language this year to assist people with diabetes who are unable to afford their insulin, and to put these forward, put this bill or language forward this year. This bill, or this amendment, excuse me, will address people who are bearing the greatest cost burden, those who are uninsured, and those who are underinsured, who end up being forced to pay the list costs for their insulin and supplies. People like a constituent of mine, the family of Alex Smith, who worked hard and was put in the impossible position of being asked to pay $1,300 for a 1-month supply of insulin. This bill, or this amendment, would set up an insulin assistance program to be paid for by insulin manufacturers. It will allow those who are uninsured and unable to pay for their insulin to have a way to get a short-term supply. This would be a 90-day supply that is paid for by a fee on manufacturers. I really think that it's important that we raise awareness the session of the issues that people with type 1 diabetes are facing. They're facing monthly payments or monthly costs of $500-$600 for their insulin supply. Prices, as I said, have doubled in just a matter of 3-4 years. And this program would allow Minnesota to reach out to those people in need and have the manufacturers who have benefited from the price increases over this short period contribute back to making it possible for people to access an emergency supply. I hope to answer any questions you have, and I hope that Senator Jensen will look favorably on this amendment. Thank you.
Discussion on the A23 amendment. Senator Benson.
Mr. President, point of order.
Please state your point of order.
Senator Wickland, this relates to directions to manufacturers. We're dealing primarily with PBMs and pharmacies specifically, and so I would say that this relates to a substantially different subject. Senator Rosen's transparency bill is a much more appropriate place for a conversation like this, and we have had that conversation in our committee, and assessing a fee for one particular drug was not something that was raised in our committee. And so as it relates to manufacturers and fees on manufacturers, I would say that it relates to a substantially different subject.
Senator Benson, are you challenging the germaneness of the amendment?
Mr. President, I'm challenging under Senate Rule 35.
Okay. Any advice? Senator Little.
Thank you, Mr. President. It is absolutely impossible in the pharmaceutical industry to separate the supply chain. How PBMs are affected affects pharmacies as well as manufacturers. How manufacturers are affected affects PBMs and pharmacies. It is impossible in any sort of thing we do here to separate that supply chain. So anything related to this supply chain, I think, is absolutely germane. Thank you, Mr. President.
Mr. President, further advice.
Benson.
There's prima facie evidence in that we are licensing pharmacy benefit managers that the supply chain is currently not inextricably linked. If pharmacy benefit managers were so closely tied to the manufacturers, then rebates wouldn't even be an issue. And so this bill specifically addresses manufacturers of insulin. Senator Jensen's underlying bill deals with pharmacy benefit manufacturers.
Further advice. Senator Little.
Thank you, Mr. President. Pharmacy benefit managers could not exist without manufacturers, so they are inextricably linked. Anything related to the entire supply chain is germane.
Further advice. Senator Jensen.
Thank you, Mr. President, and thank you, Senator Benson and Senator Little, Senator Wickland. I agree with Senator Benson's challenge in regards to germaneness. This bill, Senate File 278, creates a new chapter of law. And I would disagree with Senator Little in regards to an inability to separate the various components of the supply chain. That's exactly what we must do as legislators. This is not our task to go after the supply chain with a blunt instrument. This would be time for laser precision. And I think that the bill focuses on pharmacy benefit managers, which are actually not a part of the direct supply chain. They're actually off to the side as a middleman. So in regards to what this bill is accomplishing, I would agree with Senator Benson that this is not germane.
Members, any further advice? Members, I rule that Senator Benson's point of order is well taken and the A23 amendment is not germane.
Challenge the ruling of the president, and I request a roll call.
Senator Wickland has challenged the ruling of the president and requested a roll call. Members, the question before the body is, shall the decision of the president be the judgment of the Senate? A green vote is in favor of the judgment of the president, and a red vote is against the judgment of the president. The Secretary will take the roll. All senators having voted who have the desire to vote, the Secretary will close the roll. There being 35 ayes and 32 nays, the judgment of the President is sustained. Further discussion on Senate File 278. Senator Klein.
Thank you, Mr. President. Thank you, Senator Jensen, for the bill. Last evening, Governor Walz charged us to work across the aisle on solutions for Minnesotans, to set aside our rancor and think bigger. And this example is appropriately the next bill that we hear after that charge. Senator Jensen has worked tremendously hard over the last 18 months on this issue. And it's true that the morass of the pharmaceutical pricing in America is extremely difficult. And whichever party that you approach about this problem, they tend to point their finger at the other party. The manufacturers point fingers at PBMs or distributors, and likewise if you go to the other entities. What this bill attempts to accomplish is simply a little defense of the regular Minnesotan who comes into the pharmacy to fill his prescription for Norvasc or Lipitor and doesn't know why or doesn't even know that he could get it cheaper by paying off of his insurance plan. It shines light, which is the very first step in trying to control these prices. I'm very grateful for the bill and I support it.
Further discussion on Senate File 278. Senator Marty.
Thank you, Mr. President. And first, I did want to say I recognize it was not ruled germane, but I want to say that the insulin issue that Senator Wickland's been raising and persistent on, I think I hear people of both parties tripping over themselves to say we've got to do something about the crisis where people are literally dying, as one of her constituents did, because of a lack of insulin. And I think that's the kind of issue that deserves a hearing. It's a longer, more complex thing than amendment here normally, but I do think it's something we ought to be taking seriously because it is a life and death matter for people. To the bill itself, I want to second a lot of what Senator Klein said a minute ago. I think this is a case where both parties came together. I think some of us have been concerned about how PBMs have been operating for a couple of decades, and it's a big part of our pharmaceutical pricing problem. And Senator Jensen has pulled together people and worked very hard and aggressively on this. I'm disappointed in some things in it. I'll particularly call out that the general business practices on page 6 of the bill, PBM must exercise good faith and fair dealing, but nothing about something that Senator Jensen had originally in the bill, which I think is very important, and that's a fiduciary obligation to their customers, to their clients, whose benefit they're supposed to be working on behalf of their customers, not on their own behalf. And I think that fiduciary responsibility ought to be in there. I'm glad Senator Jensen had it in there, tried to keep it in there. I hope it can come back from the House. It's a very important thing if we're serious about addressing this. Having said that, there are many wonderful things in the bill, and I think this is finally beginning to get a handle on this portion of the pharmaceutical pricing scam that is literally killing Minnesotans and people across the country. It's obscene what's happening, and this is a bill that's a definite step in the right direction. I'm proud to join all the others in supporting it.
Further discussion on the bill? The Secretary will give Senate File 278 its third reading.
Senate File Number 278, a bill for an act relating to health care.
Third reading. Final discussion on Senate File 278. Senator Curran.
Thank you, Mr. President, and I appreciate Senator Jensen bringing this bill forward, and I rise in support of it. I think one of the things as this bill's moved through the process, and Senator Jensen's done great work, and I've expressed previous concerns around the transparency component. In order for it to work properly, we need to make sure that today the Department of Commerce has great discretion at what they deem proprietary information. And so what I would ask as this moves through the process is that we make sure to tighten that up and prescribe what can and can't be disclosed publicly to make sure it works as it's intended. Thank you, and I rise rise in favor and vote green. Thank you.
Further discussion on Senate File 278. Senator Benson.
Thank you, Mr. President. And I want to thank Senator Jensen for taking on such a heavy lift. Licensing an entire industry is not a small task to undertake, and it is not taken lightly. And Senator Marty, as you said in our committee, this deserves a good floor debate. It deserves to stand alone. I hope that my colleagues on the other side of the aisle will put up the votes to support this bipartisan transformation in the way pharmaceuticals flow to the people of Minnesota. Why does it matter that we see what goes on, pharmacy benefit managers? Because we have an industry that's challenged, perhaps even broken. We see prices jacked up and rebates given if you're an insider, if you have influence. Our very own Department of Human Services negotiates rebates. Employer-sponsored plans negotiate rebates. But do the consumers always get the benefit of those discounts? So let's look at what's going on with pharmacy benefit managers. Let's make sure rebates that are available are passed as close to the citizen as we possibly can get them. That's really important. It's also important for our health plan companies to be in good relationship with pharmacy benefit managers. And as our health plan companies are regulated, so should their upstream partners be regulated. For employer-sponsored plans, to know where they stand and that they're treated fairly in the negotiating process. And so, members, this is a part of a package of bills that we are proud to have strong authors moving through in a bipartisan way that helps the consumers of Minnesota have a better understanding of what the costs of health care are and have more say in what happens to their health care moving forward. And so, members, I hope that Senator Jensen will receive broad support on this bill, and I thank you, Senator Jensen.
Final discussion on the bill, Senator Abler.
Thank you, Mr. President and members. This has been a really hard topic, and I don't know if you have a copy of the bill, but the last page here, which is a blank piece of paper, has been how successful we've been in the last few years to get our arms around this issue. And I want to thank Senator Jensen for taking on this extremely difficult topic. And I wish this bill did some more things. I wish it could handle some of the fiduciary things. I wish we could do more with the insulin. I wish we could do some more with all kinds of elements of this. But this is a huge step forward. And Senator Jensen, I just can't give you enough credit for your tenacity and your professional expertise in finding a path that can get the support this bill is going to be getting. And people are going to be impacted by this. This is going to make prices more transparent. And already I think that there's pressure by the PBMs to pay attention to this today. I think it was Express Scripts or Caremark that just announced that they're lowering their prices for people at the pharmacy and passing on some of these rebate savings out front. And so sometimes if you work long enough and hard enough and pick up on the work of people from the past, good things can happen. This is one of those good things, and I urge people to vote green. Thank you.
Final discussion on Senate File 278, Senator Nelson.
Thank you, Mr. President. I just rise in support, and I thank Senator Jensen for tackling the PBMs. I just might have one question, if I may, for Senator Jensen. Senator Jensen
will yield. Senator Nelson.
Thank you, Mr. Chair. I just want to ensure that I believe this is in the legislation, but I just need some assurance that the issue that I found so disturbing with the PBMs was that there was a perverse incentive sometimes for them to have a higher cost drug that had a larger rebate, which ended up benefiting the PBMs and not the patients, which was really contrary to why PBMs were started. And I was just wondering if Senator Jensen would kindly talk just a bit about how this legislation would prevent that incentive that is not in the consumer's best interest.
Senator Jensen.
Thank you, Mr. President, and thank you, Senator Nelson. Your question is an excellent one. This bill does address that, not through firm and rigid prohibition of rebates, but, if you will, an exposure through aggressive transparency of the whole process of rebate, the process of downstream clawbacks, and the spread pricing. That does address it. But just to underscore the importance of what Senator Nelson is asking about, just this morning, a news report released a case study whereby Mylan has now released a generic Advair inhaler at 70% less than the cost of the trade name inhaler. So this would be a good thing, one would think, for everybody with a 70% discount. But Express Scripts has advised its pharmacists that it should not dispense the discounted 70%, probably just as good inhaler. Instead, they should go ahead with the Advair. So the 70% discount is something that Express Scripts is saying no thank you to. This must mean that there are rebates of some sort of obscure internal operation that would cause a pharmacy benefit manager to say, we're going to decline the 70% discount. We're going to go with this drug. This is exactly what this bill does in part, is it says we're going to shine a bright light on this. Again, to Senator Nelson's point, this will not rigidly prohibit the use of upstream rebates and downstream coupons, but it will at least shine a bright light on it. Thank you.
Senator Nelson.
Thank you, Mr. President. And Senator Jensen, I thank you for authoring this bill. It is a first step, and I think transparency and public awareness, light knowledge is a good thing. So thank you, Senator Jensen, for starting us on this journey to hopefully return to that point where PBMs are serving the interest of the consumers. Thank you, Senator Jensen.
Final discussion on the bill, Senator Carlson.
Thank you, Mr. President. I want to talk about a personal experience with this, and I really thank Senator Jensen for pushing the transparency that needs to be had around prescription pharmaceutical drugs. My grandmother died in 1923 from type 1 diabetes. We didn't find that out for many years because at that time it really wasn't understood. The rest of my family on my father's side had congenital diabetes. My father had type 2. My sister has, I have two sisters that have type 2. I have type 2. My son has type 1. He was diagnosed at age 16. But I'll never forget the day when I was sitting in what is now Senator Weber's seat on the floor of the Senate when I got a call from my doctor and he said, "Jim, you are a diabetic." Now that changed my life. I am now a type 2 that's under, let's say, ragged control, but I have some pharmaceuticals that I get. Some of them, our insurance, our Senate insurance covers totally and keeps me somewhat healthy. But I just had a new one, an injectable once a week, and that one gets me better coverage, and it actually has brought me down to normal blood sugars after I eat something. Like everyone, you go up, but I just checked my blood sugar now, and I'm at 252, and that doesn't mean anything to most people, except for the physicians in the audience here. And it's trending downward, so I will go down to the normal reading of 140 to 80 probably by noon, by 1 o'clock. Now, that's important to me, but also what's important is what is this pharmaceutical that I'm getting? And it's a new one. Like I said, it's an injectable once a week, but my pharmacist said it's not covered. It's going to be $928 a month. So that's what I'm facing now is $928 a month. I see this pharmaceutical advertised on television all the time. I don't know how much the television ads cost that company, but I don't think that I should get the other drugs for nothing and have a new one that's $928 a month. And that's a drug that I need to be able to stay here and continue to keep my kidneys, continue to keep my feeling in my hands and feet, and keep from having to have my foot cut off because I've lost circulation in it. So I'm really happy that Senator Jensen is pushing this bill that is going to make this kind of treatment of the consumers and patients more transparent, so we can find out just more about how our health care is becoming unaffordable to a lot of people. I can afford that. A lot of people could not. So thank you, Mr. President. Thank you, Senator Jensen.
Final discussion on the bill. Senator Jensen.
Thank you, Mr. President. I think it's important sometimes to go back to the beginning, and the beginning of this bill actually was with Senator Gazelka's decision to create a Senate Select Committee on Healthcare, Consumer Access, and Affordability. And when we met for 2 years in 2017 and 18, Senators Rosen, Wicklund, Pratt, Sparks, Klein, Kiffmeyer, Drahem, and Frentz started working on this. Then it was several months ago that I sat in Senator Benson's office with Andrea and Senator Benson, Andrea Todd Harlan, and we started to talk about what could we do. And I remember Senator Benson looking me straight in the eye and said, "Do you want this one?" I said, "Yeah, I do." I don't think I knew then what I know now, but I certainly appreciate the opportunity and the privilege to not only carry this bill, but work with so many talented people. Tim Bohl, Katie Kavanaugh, Andrea Todd Harlan, Dennis Albrecht, Veronica Fay, Senators Abler, Benson, Marty, Klein. I mentioned some of these names already. I can't thank you enough. And Senator Nelson is right. This is just the first step. And hopefully at the end of the day, if I could borrow a word from Senator Benson's testimony, we can transform the way this business is being done. It's impossible to ask patients to be good stewards of both their health and their dollars when we hide everything. Alex Azar said, it's an odd system when everybody wins in the supply chain when the price goes up, except for the patient. So I could go on for a while, but I don't think there's a need. I would say thank you to the stakeholders. We've been concerned at times that the stakeholders don't come to the table. Express Scripts, Prime Therapeutics, Optum, CVS Caremark. They've been there with us working to give it better shape. I thank them. I thank Senator Wicklund especially for her tenacity regarding elevating the consciousness regarding the insulin issue. We're not done yet. We're going to do more. So with that, thank you for your attention, and I hope for a green vote.
Members, we're on final passage of Senate File 278 as amended. Seeing no further discussion, the Secretary will take the roll. All senators having voted who have the desire to vote, the Secretary will close the roll. There being 67 ayes and 0 nays, the bill is passed and its title agreed to. Members, the next bill up for consideration is number 72 on general orders, Senate File 13, Senator Draheim.
My success. Thank you, Chair Miller, or President Miller, excuse me. First off, I'd like to thank the co-authors, Senator Anderson, Eichhorn, Dr. Klein, Senator Housley, the staff, of course, the committee chairs, and everybody that had input into this bill. We've had a long journey with this one, a lot of changes, a lot of inputs from both sides of the aisle. I appreciate everybody's attention to this small little bill. And I guess, President, if I could, I'd like to offer the A6 amendment first.
Senator Draheim offers the A6 amendment The Secretary will report the Draheim amendment.
Senator Draheim moves to amend Senate File Number 13 as follows, page 1 after line 20. Insert. This is the A6 amendment.
To your amendment, Senator Draheim.
Thank you, President Miller. The A6, all it does, it says effective date. This section is effective August 1st of 2020. So we're given an extra year for the hospital groups to enact this. It was a suggestion that came up, and I think it makes the bill better. So thank you. And just a real quick recap of the bill, too, if I could, real quick.
Senator Draheim, let's vote on the amendment first. Members, any further discussion on the A6 amendment? Seeing none, all those in favor say aye.
Aye.
Opposed say no. Motion prevails. The amendment is adopted. To your bill, Senator Draheim.
Thank you, President. The Senate File 13 is just a disclosure bill, kind of my path on transparency in healthcare. What it does is it requires hospitals to send us a bill that we can understand within 30 days. So an itemized description of what we had done. The hospitals can't charge for this itemized bill, and they may send it out in a secure email or a secure online portal or via the Postal Service. And that's it, Senate President. Thank you.
Members, any further discussion on Senate File 13? The Secretary will give Senate File 13 its third reading.
Senate File Number 13, a bill for an act relating to health.
Third reading. Members, any final discussion on Senate File 13? We are on final passage of Senate File 13 as amended. Seeing no further discussion, the Secretary will take the roll. All senators having voted who have the desire to vote, the Secretary will close the roll. There being 66 ayes and 1 nay, the bill is passed and its title agreed to. Okay.
Next bill under consideration is number 80 on the general orders, calendar Senate File 1257. Senator Miller.
Thank you, Mr. President. Members, imagine being at a concert, a sporting event, or another gathering when suddenly you see someone having an allergic reaction. If you carry an EpiPen, your first instinct would very likely to be to grab your EpiPen and to help administer it to that other person. But this is prohibited under current law. Allergic reactions can turn life-threatening very quickly, and acting very quickly to address that allergic reaction is extremely critical. Senate File 1257 would allow any individual who has been certified by an anaphylaxis training program to obtain and administer the life-saving medication epinephrine, commonly known as an EpiPen. After receiving the necessary training, Senate File 1257 would also protect the trained individuals under the state's Good Samaritan protection laws. Senate File 1257 is modeled after a Wisconsin bill that passed in 2017 called Dillon's Law. Dylan Miller passed away at the age of 18 as a result of a bee sting. The legislation is truly a grassroots effort led by Dylan's family to help save lives. Members, today I ask for you to join me in passing this bill to make an effort to help save lives throughout the state of Minnesota. With that, I stand for questions.
Members, any discussion? Senator Little, or Senator Klein.
Thank you, Mr. President. Thank you, Senator Miller, for bringing the bill. It's a meritorious bill, and I'm glad we can do right by the family who lost so tragically their son to an anaphylactic reaction. It is worth mentioning that training in how to use an EpiPen may be helpful, but it is far from the most serious barrier to obtaining EpiPens in America. The company Mylan, which produces an EpiPen predominantly, it's been estimated that their cost per production is $20, and their market cost for the EpiPen is $600. Senators, that is the significant barrier to this life-saving medication reaching the patients it needs most. And if we are serious about making sure that the people who need EpiPens receive EpiPens, we will proceed with some of the pharmacy oversight legislation that has been advanced this session and get serious about that work. Thank you, Mr. President.
Senator Nelson.
Thank you, Mr. President. I have an amendment.
Secretary will report the...
What number?
The A1. Oh, excuse me, the A3.
The Secretary will report the A3 amendment.
Senator Nelson moves to amend Senate File number 1257 as follows, page 1, line 22 after federal insert. This is the A3 amendment.
Senator Nelson.
Thank you, Mr. President. And I thank Senator Miller for bringing this important bill. The amendment before us simply puts in a little bit of language regarding the EpiPens in schools. I know that we just want to make sure that there is nothing that is assumed that that an authorized individual to possess or administer an EpiPen would on school property. So nothing would be construed to permit that authorized individual to possess or administer an epinephrine auto-injector to a student while on school property. And then we just ask that the possession and administration of that EpiPen on a school property would be determined by the school district in accordance with sections of law already in place. This is merely comfort language. I've visited with Senator Miller about this and offer the A3. This was brought to me by our school nurses.
Thank you, Senator Nelson. Any discussion? Senator Marty.
Thank you, Mr. President. Senator Nelson, I understand your desire to have comfort language. I just wonder, though, I mean, since one of the goals is to make sure people feel comfortable with the idea of using an EpiPen to save a life, doesn't this send the wrong comfort message to people? Well, nothing in this authorizes you to do that. I know that folks in schools aren't going to do it, and I know the school districts are, I would guess most school district policies do authorize people to take a life-saving step like this, but I'm wondering, how is this comforting when it may actually be sending the wrong message to people?
Senator Nelson.
Thank you, Mr. President, and Senator Marty. This is language that is most likely already in place in our schools. I can remember as a middle school teacher the strict guidelines for EpiPens, where those are kept, how those are used. And Senator Marty, I would just direct you to the line 1.7 in the amendment, which specifically describes that the public school, that it shall be determined at the school district level in accordance with existing law. So again, anytime we bring any type of medical or drug-related things into our schools, it is very important that there be that locally determined policy to determine how those are handled, stored, and used.
Mr. President.
To that point?
Yes, Mr. President, Senator Nelson, I appreciate the comment, and I believe it should be, these decisions should be made by local school boards, but I also don't see that this is very comforting language. It's fine to put on, but it does send a discomforting message to people when the goal is to make sure people are ready to use EpiPens on the spur of the moment.
Senator Miller.
Thank you, Mr. President and members. Senator Nelson did discuss this amendment with me, and I'm supportive of the amendment. I see, Senator Marty, what you're saying. For it to be comfort language, this isn't the way it's worded might not necessarily be very comforting. So we can try to perhaps work on that a little bit if this goes to conference committee. But with that said, I would consider this a friendly amendment.
Senator Hoffman.
Thank you, Mr. President, and thank you, Senator Nelson, for having this discussion. The thing that exists, Senator Miller is putting together a Good Samaritan clause, which is basically leaves it wide open, which is a good thing. School districts, there's some language that I think Senator Nelson should take a look at, and I guess I would question on. There are two. There's permissive and there's non-permissive language. Like school districts must develop an individualized health plan for an individual who's going to have an EpiPen. So what that means is you're going to create some paperwork burdens that are going to exist. And I shouldn't say burden because we should have that kind of paperwork trail because of due process rights. But here's where it comes unclear, Mr. President, and maybe Senator Nelson can do this. If I'm at a basketball game on school property and I'm a student and I haven't had that individual health plan, on one case I would be violating the rule of order within the school district guidelines. Hence, I could be brought in front of the school board for numerous things, including up to expulsion. That would be Pupil Fair Dismissal Act stuff. But at the same time, in Senator Miller's bill, it would say that, no, I'm doing a Good Samaritan Act and I would be protected. So there's some conflicts I think they need to work out, Mr. President, and if Senator Nelson would like to comment on that, I would appreciate it. If not, I would like to see this definitely get worked through if it goes to conference committee, and maybe Senator Miller could do that. Thank you.
Senator Nelson.
Thank you, Mr. President. The discussion on the floor, I think, brings good points, but we do also need to, I believe, work through this further in conference committee. I have visited with Senator Miller. We will continue to work through this in conference committee, but in deference to the further discussion on the floor today, I will withdraw the A3 amendment and know that the discussion will continue in the conference committee as they work through the intent of the bill, and also making sure that our schools have the ability to have local policies regarding this for the safety of all. So in that, I withdraw the A3.
Thank you, Senator Nelson. The A3 amendment has been withdrawn. Any further discussion, members? Then the Secretary will give the bill the third reading.
Senate File Number 1257, a bill for an act relating to health care.
Any further discussion? The Secretary will take the roll on final passage.
Yeah, it was the first sentence was the problem, I think.
All senators having voted, the roll is closed. The Secretary will close the roll. There being 67 ayes and no nays, the bill is passed and the title is agreed to.
Members, the next bill up for consideration is number 62 on general orders, Senate File 277, Senator Jensen.
Thank you, Mr. President. Colleagues, today I present Senate File 277, and I would like to thank my co-authors, Senator Kiffmeyer, Senator Benson, Senator Klein, and Senator Abler. This bill basically establishes the opportunity for a legal framework for direct primary care contracts. A direct primary care contract is an agreement outside the scope of insurance between an individual or a family and their doctor. This is already being done, but this would allow for the formation of such a person-to-person contract outside of the scope of insurance. With that, I'll stand for questions.
Members, discussion on Senate File 277. Senator Kiffmeyer.
Thank you, Mr. President. I want to especially thank you, Senator Jensen, for bringing this bill forward, and I'm glad to be a co-author of this bill. And as Senator Jensen said, this bill is not insurance, and it clarifies that in this bill, sets that up and sets a legal framework. But many folks have asked just exactly what is direct primary care. Well, it's a direct agreement between the patient and the doctor. So if the doctor chooses to offer a direct primary care plan, the patient can choose to use that particular doctor, goes into an agreement, and then they have that established relationship. No middle person. You want to see that doctor in your direct primary care plan, you are able to call, get in, and see that patient. You can also use insurance. It doesn't mean you can't do insurance, so just so you know, you can do that. So it works by having a direct agreement with a direct monthly low fee. You get direct care, and again, no extra charges. Primary care would include things like screening and treatment, diagnosis, injuries within the primary care physician's scope of practice, medical supplies in the office, and lab work through the clinic, which means that if you have a sore throat, with this primary care, direct primary care in place agreement, you get in to see your doctor with no additional charges. You get to have a lab test for strep throat maybe, no additional charges. You can have treatment, diagnosis, you quickly get in, you meet your needs, no waiting, no middle person, no waiting. And so with that direct monthly fee, it really expedites getting your care. It's innovative, and it deserves our vote here today on the Minnesota Senate floor and also in the House, and to send this to the governor. It's innovative and will help to lower costs, but the most important thing that I hear from people is that it creates that relationship with the doctor and the patient directly with no middle person. So members, I ask for your support for Senate File 277. Thank you.
Further discussion on Senate File 277, Senator Klein.
Thank you, Mr. President. Thank you, Senator Jensen. I'm glad to be a co-author on the direct primary care bill, and I'm grateful to Senator Kiffmeyer for an accurate description of what it accomplishes. It is important, however, to note what it attempts to accomplish and what the limitations are of direct primary care. If you are a patient engaged in a direct primary care contract with a provider and you go in with a mole that needs to be examined, the primary care provider may look at that, examine it, may excise the mole. But if at the next stage that primary care provider discovers that you have a melanoma, the services you require are outside the scope of a direct primary care contract. You will then need some sort of insurance coverage, some sort of health plan to see an oncologist, to see a surgeon, to receive some chemotherapy to get treatment. It is not a solution to the health care access and affordability problem that we have in Minnesota. It is not available to patients who are extremely low income or hardworking. It is a small tool that may optimize provider care, primary care, to people who are able to afford this product. There are solutions before us this year, Senators, which do attempt to solve the larger, more pressing problem of healthcare access and affordability to every single Minnesotan, the most exemplary of which is Governor Walz's OneCare option, which provides a public insurance product that is affordable to all Minnesotans. And with that, Mr. President, I will offer the A1 amendment.
Senator Klein offers the A1 amendment. The Secretary will report the Klein amendment.
Senator Klein moves to amend Senate File number 277 as follows: delete everything after the enacting clause. This is the A1 amendment.
To your amendment, Senator Klein.
Mr. President, as described, this is the OneCare option authored by the governor, and which I believe is familiar to all of us, a public option to attempt to ensure affordable, high-quality health care to every Minnesotan. And with that, I request a roll call.
A roll call has been requested. A roll call will be granted. Any further discussion on the A1 amendment? Senator Benson.
Thank you, Mr. President. I understand, Senator Klein, your efforts to get the OneCare discussion placed before the legislature. I just want us to start a deeper conversation about what government-controlled health care would look like. And Senator Klein, you proposed the governor's approach, which is actually more government, putting taxpayer dollars at risk, as was specifically raised in committee this week. And Senator Draheim is taking exactly the opposite approach. Let's give the choices more directly to consumers. Let's focus more on the doctor-patient relationship and less on what the government is doing. And so, members, we can have a really long discussion on OneCare. I have files full of reasons to vote no. And I'm sure we're going to have a deeper conversation on OneCare as bills move through this body. But for now, I'd ask for a no vote on the A1.
Further discussion on the A1 amendment, Senator Frentz.
Thank you, Mr. President. I rise in support of this amendment. What we hear from farmers in our district is we need more choices. This is another tool in the toolkit to help rural Minnesotans make a choice that's best for their family. And this is a lowering of the monthly premium. So I'd ask members to look and say to themselves, if this option will lower the monthly health care premium for a family that's working on a farm in rural Minnesota, why would we vote against it? Thank you, Mr. President.
Any further discussion on the amendment? See no further discussion. The Secretary will take the roll on the A1 amendment. All senators having voted who have the desire to vote, the Secretary will close the roll. There being 32 ayes and 35 nays, the motion does not prevail and the amendment is not adopted. We are back on Senate File 277. Further discussion, Senator Marty.
Thank you, Mr. President, and I thank Senator Klein for his amendment, which I think would have given people across the state a good, affordable option. I wanted to speak to the bill, in favor of the bill, and I wanted to say that a lot of what Senator Kiffmeyer said I would strongly agree with, other than when she said it was an innovative approach. It strikes me as this is the way we used to deliver care in the past. You go to the doctor and you work with the doctor, and the doctor makes recommendations and you deal with that. That's the way a medical system should be, with a doctor-patient relationship. But the whole reason we have people coming with this kind of thing is to get around the insurance industry here. This is not an insurance product, as she and Senator Jensen mentioned. This is a wise thing to have. If you've got a high deductible policy and you got the money to be able to pay for this, I would definitely encourage somebody to do this direct primary care. It's simple and everything else. But that's why we ought to look at the whole health care system. Senator Benson, you said that that's why you don't like government-based health care. I've got a health care plan that is as far from government-based as you could have it then, because it would basically have the entire system determined by patients and the doctors and providers they choose, without interference from government or insurance company or employer or anybody else. That's the way to do it. This bill is a tiny step for people. Basically, it shows how doctors and everybody are getting fed up with the messed up system we have. Spend all their time filling out paperwork, filling out insurance forms, trying to make sure it's covered, trying to make sure they're in network and all the other problems. And some doctors are just saying, I don't want to do that anymore. I just want to provide direct care, and so this is a good option for them. But the whole question is, why don't we do it for everyone instead of just a handful of people who want this in addition to their insurance? But it's a good bill. It's a tiny step, but it's a good bill in the right direction.
Further discussion on Senate File 277. See no further discussion. The Secretary, can we go to third reading? Senator Wickland. The Secretary will give Senate File 277 its third reading.
Senate File number 277, a bill for an act relating to health care.
Third reading. Final discussion on the bill. Senator Wickland.
Thank you, Mr. President, and I'm sorry for not standing up soon enough there. I just wanted to say I think there are some good ideas in this bill, and this idea that patients getting more time with their doctors is something that I've heard expressed both from a provider standpoint and a patient standpoint. They would like to have that. I guess there's two areas of concern I have with the bill. One is in terms of consumer protections. If something in the agreement does go astray or amiss, it seems to me there's limited options for patients or providers to kind of have somebody else to go to hash out any disagreements. Really, if there is a concern that rises to the level of deviating from professional standards, it can be brought to the boards, the Board of Medical Practice or the Board of that licenses professional healthcare workers. But I mean, their job is really to evaluate concerns from the standpoint of whether the concern is impacting public safety, and they need to address concerns that are related to protecting the public. I don't think that the type of concerns that might arise from these agreements are well handled by that sort of process. And consumers really don't have someone else to go to say that, maybe there's a concern about a service that they thought would be included and isn't included, and so on. So I have a concern about that. And then I also just like to say, I think that this bill should have gone to the HHS committee to have further discussion about possible impact on primary care, and the need for primary care physicians across the state. And while it seems like a good model for primary care physicians, and I know we want to retain primary care physicians, but the direct primary care practices will, by necessity, take on fewer patients if they're going to be allocating more time to each patient. And I have a concern that we didn't really have a chance to discuss, well, what is the impact in areas that might have a primary care shortage? What are we doing to address that by way of direct primary care practices setting up shop in these areas? And so I based on these concerns, I wish we'd had a chance to discuss that in the Health and Human Services Committee, and discuss whether overall this is a good thing for Minnesota to have to encourage this direct primary care relationship. Thank you.
Final discussion on Senate File 277. Senator Hayden.
Well, thank you, Mr. President. Will the author of the bill yield?
Senator Jensen will yield. Senator Hayden.
Well, thank you, Mr. President. Senator Jensen, I thought you were going to respond to Senator Wickland's kind of inquiry. Can you help us understand why this bill did not go to the HHS committee?
Senator Jensen.
Thank you, Mr. President, and thank you, Senator Hayden and Senator Wickland. This bill basically does one thing. It establishes a relationship between a patient and a physician as non-insurance and allows them both to go into a voluntary contract, much as they would anything else. And that's the extent of the bill.
Senator Hayden.
Well, good. And Mr. President, thank you, Senator Jensen. So I'd just be concerned because unlike many of us, Senator Jensen, we don't always know what happens in those relationships. We've having these complex conversations about, transparency and hospital transparency and pharmacy benefit managers and the trend to go to primary care and all the great work that you do at your clinic and the great work that Senator Klein does in the hospital. But there often are things that we don't know. There's often stakeholders in the legislature that can help us understand and look for unforeseen issues or unintended consequences. And Senator Jensen, I know that this is something that you understand, and I'm sure that you have thought these things clear and know how this works. But I do think that it sets a bad precedent, Senator Jensen and members, that we have things that deal with health care, that have things that deal with a relationship between, and we're changing laws or adding sections of law, but we haven't fully vetted them. So Senator Jensen and I could go on and ask Senator Benson to yield and start to go through that process. It's not kind of my interest today, but I do want to put on the record that I do think that we should be very careful and tread very lightly as we figure out subject matters that in our haste to do something or us looking at it from our perspective, that we don't use the legislative process as we have today to walk these bills through their prospective legislative process. So I guess I would say to the majority, Mr. President, that I hope that this doesn't become a trend that we see bills that are coming on the Senate floor that haven't gone through a process so that we can vet them. Thank you, Mr. President.
Senator Jensen.
Actually, Senator Miller, Mr. President.
Senator Benson.
Senator Hayden raised my name, and so I would like the opportunity to comment. This bill does not deal with the licensing of physicians, which is the purview. It doesn't deal with the practice of physicians, which is the purview of our committee. It doesn't deal with health plan companies. the purview of our committee. It deals with excluding a category of professional from requiring to behave as though they're an insurance company. That is exclusively the purview of the Commerce Committee, and that is why it wasn't heard in our committee.
Final discussion on Senate File 277. Senator Jensen.
Thank you, Mr. President, and thank you, colleagues, for the good discussion. To Senator Wickland's point regarding a potential unintended consequence of allowing a direct primary care relationship to exist, they already exist. And I think that Senator Wickland, without meaning to probe any motivation at all on your part, I would just say that one of the motivations of this piece of legislation is to allow physicians to stay practicing. Many physicians reach a point in this very regulation-driven industry. It's so different than when they went through medical school and residency that they're ready to say, I'm done, whether it's at 50, 55, or 60. This gives them new life because this gives them that chance for a relationship. Andy Slavitt, who has worked with the U.S. of Care and has worked with former President Obama, has myriads of data indicating that after a relationship has been in existence for 3 to 4 years between a patient and a physician, costs start to drop. And that's because when you know that there's a bond of advocacy and trust, a lot of those unnecessary interventions that can put a patient in harm's way, they're not done. So thank you, Senator Wickland. I appreciate your input, always thoughtful. Senator Hayden, I couldn't agree with you more. I hope that this isn't becoming a trend whereby we use legislative tools to not have the full discussion that we want. And I would ask that everybody in this body reach out to our colleagues in the other chamber and encourage them to have these kinds of discussions that we're having on the floor of the House so that these bills can be vetted, if you will, in the open light of day where the public can see what we do and what we vote and what we believe. This is certainly no time for squashing things together into omnibus bills. This is a time for saying, listen, every bill that we can, single subject, let's have it go before us. So thank you, Senator Hayden. I agree with you so much. I appreciate it. And I also would want to say thank you to Andrea Todd Harlan and Tim Bull for their work on this bill. This is a good bill. The Chamber of Commerce, without any request from us, said, we're with you, and you received the letter on that. The MMA has supported this. Organization after organization has supported this. So I hope for a green vote. Thank you, Mr. President.
Members, we're on final passage of Senate File 277. Seeing no further discussion, the Secretary will take the roll on the bill.
We're going to get to you today?
Are you doing the liquor bill today? Yep. Did you work out the amendment thing? They're doing the amendments on the growlers. And removing the cap.
They got it.
All senators having voted who have the desire to vote, the Secretary will close the roll. There being 67 ayes and 0 nays, the bill is passed and its title agreed to. The next bill up for consideration is number 74 on general orders, Senate File 2130. Senator Dames.
Well, thank you, Mr. President. Senate File 2130 is the omnibus liquor bill. Again, we've kept it very small again this year, and I'll just kind of go through the provisions that are included in the bill. On Section 1, it allows an extension of the hours of operation in the secured areas in the airport. There is an area in the airport, the secured areas in the airport have a lot of folks coming in from around the world in different places, and currently they can serve alcohol until 2 a.m. and then start serving again at 6 a.m. And so this would allow for the 4 hours in that gap. Is like I said, we have a lot of international travelers that may want to sit down and have a wine or a drink with their meal, and for them it may be their meal time if they're from another country or a different time area. The second, the Section 2 changes the municipality score pension obligation. Currently with the new GASB rules, the GASB rules will require that the municipalities score their pension obligations in their profit and loss statement. This would remove that. Section 3 and 4 pertain to junior hockey leagues in the arenas. This is something we've done in the past. One of these arenas is in Rochester, and one of these arenas is in Austin. Section 5 is a grant for on-sale liquor at the Roseville Golf Course. Section 6 allows the City of Pemberton to issue a liquor license to the Pemberton Community Center. In Section 7, changes the way the City of Alexandria can issue a temporary liquor license to the Legacy of the Lake Museum. Members, there's also 2 friendly amendments that will be made. One will be for the City of Piers and one for the Twin City Marathon. Members, that is the extent of the bill, and I'll certainly stand for questions.
Discussion on Senate File 2130. Senator Gazelka.
Thank you, Mr. President. I have the A4, which is the language related to City of Piers.
Senator Gazelka offers the A4 amendment. The Secretary will report the Gazelka amendment.
Senator Gazelka moves to amend Senate File 2130 as follows, page 1 after line 12. Insert. This is the A4 amendment.
To your amendment, Senator Gazelka.
Mr. President, members, the language is simply the City of Piers may issue an on-sale intoxicating liquor license, on-sale wine license, and on-sale malt liquor license to the city-owned Piers Golf Course.
Discussion on the A4 amendment. Seeing none, all those in favor say aye.
Aye.
Opposed say no. Motion prevails. The amendment is adopted. Further discussion, Senator Dibble.
Thank you, Mr. President. I would like to offer the A3 amendment.
Senator Dibble offers the A3 amendment. The Secretary will report the Dibble amendment.
Senator Dibble moves to amend Senate File 2130 as follows, page 2 after line 8. Insert. This is the A3 amendment.
To your amendment, Senator Dibble.
Thank you, Mr. President and members. The A3 amendment is the Twin Cities Marathon amendment that Senator Dames referred to a few minutes ago, and it simply allows that the marathon, on the marathon weekend, when the runners finish their race on Saturday as well as Sunday, which is currently allowed, that the marathon is able to offer them a refreshing adult beverage at the conclusion of their race. There are races that go on Saturday, and on Sunday, of course, if you finish the 10-miler or the full marathon, you can have a delicious Minnesota-produced brew, and now the Saturday racers would be able to do the same out here on the Capitol lawn. Thank you, Mr. President.
Senator Dibble, you're making me thirsty. Discussion on the A3 Dibble amendment. Seeing none, all those in favor say aye. Aye. Opposed say no. Motion prevails. The amendment is adopted. Further discussion on Senate File 2130. Senator Housley.
Thank you, Mr. President. I have the A10 amendment.
Senator Housley offers the A10 amendment. The Secretary will report the Housley amendment.
Senator Housley moves to amend Senate File 2130 as follows, page 1 after line 6. Insert. This is the A10 amendment.
To your amendment, Senator Housley.
Thank you, Mr. Chair. And the 2 friendly amendments serve my point of my A10 amendment. The A10, ever since I've been here, every year there are special permits granted here at the state for cities and towns to do special permits for festivals to do serve liquor. And we have never, ever said no. We've always let the cities decide, local control, what they want to issue special permits for liquor licenses. So what my amendment does, it just gives the control back to the city so they don't have to come here to the state anymore. Any establishment located within the city's jurisdiction on such terms and conditions that those cities will apply.
Discussion on the Housley amendment. Senator Dames.
Well, thank you, Mr. President, and I would rise and not favor this amendment. What this seems to be doing is currently, if you want to get a license, it's a specified license for a restaurant or a bar or whatever, particularly, and this would just eliminate that. It would just be any license without there would be nothing stating what the license was actually for. It could be for, like I said, a restaurant or a bar or a country club or whatever. And so I think we need to stay with the system we have so we kind of know where we're going with our license.
Senator Housley.
Thank you, Mr. President. In the current language, every year it gets a little bit longer and longer. Hotels, restaurants, bowling centers, clubs, sports facilities, exclusive liquor stores. With this amendment, we can let cities decide, which they already are, and we are an extra step that they have to go because we have not said no in the 7 years that I've been here. So letting cities have local control and decide who they want to let have special liquor permits for their cities or their events or their festivals, I think is just giving local control back to the cities. And I ask for a yes vote.
Further discussion on the A10 amendment. Seeing none, all those in favor say aye. Aye. Opposed say no. No. The motion does not prevail. The amendment is not adopted. Members, we're back on Senate File 2130 as amended. Senator Housley.
Mr. Chair, I have the A8 amendment.
Senator Housley offers the A8 amendment. The Secretary will report the Housley amendment.
Senator Housley moves to amend Senate File number 2130 as follows. Page 1 after line 6, insert. This is the A8 amendment.
To your amendment, Senator Housley.
Thank you, Mr. President. I would like to make an oral amendment to my A8 amendment, if I could.
Senator Housley, please state your oral amendment.
On Section 1, Line 8, cross out 250,000 gallons and put in 40,000.
The Secretary will report the oral amendment to the A8 amendment.
Senator Housley moves to amend the A8 amendment as follows. Line 1.8, cross out 250,000 and insert 40,000.
To your amendment, Senator Housley.
Thank you, Mr. President. Currently, Minnesota law requires a brewery to stop serving growlers from their tap room if their brewery produces more than 20,000 barrels annually. The original amendment had a 250,000 cap of barrels brewed annually. There's only 5 breweries in the state that would be able to sell growlers under that cap, but we have breweries around our state, and I have one in my district, Liftbridge Brewery, who want to grow. Our small breweries in the state employ over 8,000 people. And in my case, Liftbridge Brewery wanted to buy the Armory because they wanted to grow, but they're already at the 18,000 barrel cap, and they will hit 20,000 before the end of this year, and then they're not allowed to sell growlers once you surpass that 20,000 cap. So the Craft Brewer Guild is asking for just a little bit of an increase. They don't need to go to 250,000 barrels, but just a little bit, because there is Castle Danger in Senator Bach's district. There's Bent Paddle in Senator Isaacson's district, or Simonson's district. and indeed in Senator Dietzig's district and Lethbridge in mine, and other craft brewers throughout the state that do want to continue to grow. And I don't know what other industry we do this, that we tell them tell drugstores how many pharmaceuticals they can sell and put a cap on it. This is the one industry that we have small businesses really wanting to grow, but because we at a state here don't let them, I think increasing the cap to 40,000 is a really modest compromise to go from 200. And even the federal government defines small breweries as anybody brewing under 6 million barrels a year, and very small brewers that brew under 60,000 barrels a year. So these are still very small breweries, but just asking to increase the cap to 40,000 barrels. What it doesn't do is it doesn't change anything in the three-tier system, because they already are capped at how many growlers they can sell, and 750 barrels worth of growlers is all they can sell. We're not changing that. We're not increasing the cap on that they can sell more growlers than the 750 barrels worth. That's staying the same, but this is allowing them to grow and brew more beer. Thank you.
Discussion on the amendment to the amendment. Senator Dames.
Thank you, Mr. President. And again, I'm going to rise in opposition to this amendment. We are changing from 20,000 in this amendment to 40,000. And it's not just simply the sale of growlers. It also involves the distribution. We have the three-tier system in Minnesota. It's worked well. People that have adhered to it and worked with it. And what that says is over 20,000 barrels, they would no longer be able to self-distribute. But one of the things I think we need to keep in mind is we were at, I think, was 3,700 barrels, and then it was moved to 20,000 barrels. And that took a couple years to get to that point, because it took the time for both sides to get together and to work this out and to come up with a solution. This solution was agreed to, and it was agreed that at that point, when we hit 20,000 barrels, that we would no longer be able to sell growlers, but that we would also have to go into the distribution system and adhere to the three-tier system. Now, I know that some people probably don't like the three-tier system, but then we need to take a look at changing the three-tier system instead of just eating away at it. So I do stand in opposition to this amendment, and I'd ask for your vote against it.
Senator Housley.
Mr. President, I would like to withdraw the A8 amendment, and I have the A52 amendment.
Senator Housley withdraws the A8 amendment. Senator Housley offers the A52 amendment. The Secretary will report the Housley amendment.
Senator Housley moves to amend Senate File Number 2130 as follows, page 1 after line 6. Insert this is the A52 amendment.
To your amendment, Senator Housley.
Thank you, Mr. President. And again, this is the originally they wanted 250,000 barrels to increase the cap to that, and got the craft brewers to pull it back to 40,000, and it does not change the three-tier system. They are not allowed to sell any more growlers out of their small businesses, and if anything, it's more business for the distributors, because they're brewing more beer, which has to go into their system that they have to deliver. So my Lethbridge brewery brews more beer, and they can it and bottle it. Can't be sold out of their brewery right in Stillwater. It has to go through the distributors, who then brings it to the liquor stores or to the restaurants or bars. So it is not changing anything to the three-tier system. It is allowing our small businesses to grow.
And Senator Housley, the A52 is the same explanation as the A8, correct? It's just the
Mr. President, yes, it actually, the A52 was Senator Pappas's amendment, and it has the correct number of barrels in it.
Okay.
So it's the right.
Members, we are on the A52 amendment. Senator Dames.
Thank you, Mr. President. Again, I would rise not in support of this. We're changing from 20 to 40,000 barrels. It does interfere with the three-tier system because of the distribution. So I would ask for a vote against this.
Further discussion to the bill, Senator Hoffman.
Thank you, Mr. President. Members, I request a roll call.
A roll call has been requested. A roll call will be granted. Further discussion on the amendment, Senator Bach? Senator Pappas.
Thank you, Mr. President. I rise to support the Housley amendment. The craft brewery industry has done a tremendous service to a lot of our small towns and our communities. Really brings a lot of vitality to the area. They are very popular with the younger crowd in particular, and it really, I think, it's a small business that we should encourage and not create a lot of barriers for them to do some minor growth. Going from 20,000 to 40,000 barrels is not that big of a leap. They're growing in leaps and bounds already and are bumping up against that $20,000 limit. What current law would mean is they couldn't sell growlers if they went over the 20,000 barrels. And there's still a small craft brewery. The federal government defines a small craft brewery as a brewery producing less than 2 million barrels annually. We're at the 20,000 to 40,000 barrel limit is what we're talking about. They're still very small businesses. They're not going to compete with the big, large breweries out of state, most of them, the Millers, the whatever is still out there. I don't even drink beer. But I have found that when I've gone to a small craft brewery, they have a lot of interesting flavors that you can even tempt a person like me who doesn't even like beer. But more, I'm in favor of helping these small businesses grow. It's good for our communities. It's good for tourism up on the Iron Range with breweries up in Duluth, and it's a very small change. I think that the inability for the opposition to compromise at all, even on such a small item as this, just shows a lot of intransigence. And if we are ever going to grow these industries and help these small craft breweries, we have to be a little more responsive. So I urge people to support the amendment.
Further discussion on the amendment, Senator Osmek.
Thank you, Mr. President. I can't agree more with Senator Housley and Senator Pappas. What we did in 2013, members, is we unlocked a market in Minnesota. We had a handful of craft breweries in Minnesota. When we changed that cap, we created breweries that now are sprouting up of all places in Hutchinson. Senator Newman is going to have one in his backyard. Those didn't happen by accident. Lifting that growler cap was important in creating small businesses in Minnesota. And these small businesses are paying great wages, and these are the things, every time I look around, we always talk about helping small businesses in Minnesota. This is the ultimate small business because they take the risk, they create a brewery, and they want to sell growlers. And I have to disagree with you, Senator Dames, respectfully. I'm going to use Liftbridge as an example. They were one of the originals that was here and was helped by the 20,000 cap. They went from just growlers to 16-ounce cans, now to 12-ounce cans. They have gone into the distribution chain now. Growlers for someplace like Liftbridge is now a novelty of people that are actually going to that brewery. Actually, and you can actually get, in this case, I happen to prefer Farm Girl as a beverage from them. You can buy this cheaper in the liquor stores than you can in the growlers that they actually sell. You actually pay more for the growlers versus less for the growlers. So, members, this is a good amendment to help small businesses, and if you want to help small businesses in Minnesota, you vote green on this amendment.
Further discussion on the amendment, Senator Dames.
Thank you, Mr. President. I just wanted to speak in regards to some of the comments that have been made here. You know, I don't believe that changing the growler cap in 2013 created these new businesses, because I don't think somebody that was looking at starting a brewery in 2013 and heard that the growler cap had been changed made the decision for them to get into it. Back in 2012, we had 30 microbreweries. 2013, we had 34. 2017, we have 113. Let me point out that at 113, there's 5 of them that are near or pushing the cap. So the other 100 and whatever that would be, 108 are not pushing the cap. So I don't think that this is an industry-shaking thing to have this changed. Along with that, if people are going to buy growlers, if they don't buy them from somebody that's over the 20,000, they'll probably go buy them somewhere else. So I don't think that this, to say that this is an economic driver, I don't buy that. I think that what we're doing here is we've got a solution. We've got what we feel is a solution, chasing a problem that doesn't exist. So again, I would request a red vote on this amendment.
Further discussion on the amendment, Senator Housley.
Thank you, Mr. President. And Senator Dames, I respectfully disagree. For those 8,000 people who are employed by these small breweries, it is an economic driver, and for their families and for those cities and towns. And many of them it drives tourism. Two Harbors relies on Castle Danger to bring a lot of people to Two Harbors. And same with Stillwater and same with Duluth. It is really big for our communities. And I think it's disappointing that there is resistance from the three-tier supporters. This is not, again, like I said, not going to affect it, like Senator Osmick said. Lithbridge is actually contributing to more cans and bottles being distributed by the distributors. And still, it will be, if they do go over, and they will this year, Lithbridge and Castle Danger, go over their 20,000 barrels, which they will, people will be going to these tourist destinations to get a growler, and they won't be able to get one and enjoy one right there in Castle Danger. So I will withdraw the A52 amendment disappointedly. I think it's a discussion that still needs to be had, and there still needs to be some negotiations because this is very, very important to an industry that is growing. Thank you.
Members, I had a couple names on a list. I just want to make sure that we're good. Okay. Further discussion on Senate File 2130, Senator Bach.
Well, Mr. President, Senator Housley, I want to thank you for withdrawing the amendment. Members, there is a deal to be made here. There is a deal to be made, but we have to talk about the elephant in the room. This amendment is not about growlers. This amendment is to allow these smaller craft brewers to sell six-packs and other alternative size vessels, which will be a huge departure from where they currently are, and that's what the larger industry is concerned about. There is a deal to be made on the barrel cap if the Brewers Guild are willing to not come back here next year or the year after and want alternative sizes and start pushing cases and cases of six-packs out the door. That's what the larger industry is worried about. No one wants to vote for the 40,000 barrel limit more than me. Castle Danger is in my district. 100,000 people a year come to that little town of Two Harbors and visit Castle Danger Brewery. But I don't believe their intent is to sell six-packs out the door and come back here next year and be able to do that. But there are others that want to, and the larger guild wants to. I think we should try and figure out a way to address this issue this session, Senator Dams, but I think we can't until the two sides get together and talk about what the real motive of this is. Because I don't believe the way it's being portrayed as being about growlers is really what it's about. I do believe that's what it's about for my little brewery in Two Harbors. But there's something more going on, and no one is publicly talking about it. So, Senator Housley, I appreciate you withdrawing it. I wouldn't have wanted to see it fail because I think there's still a conversation that could happen. There's a lot of time left in this session. I just would encourage the people on both sides of this to get together. There's time yet in this session to find an agreement where we don't have these warring parties bringing their disputes to the legislature and asking us to pick a side. So that's my request of the people I'm sure that are watching today on both sides of this. Get together in a room. There are some of us that would probably be willing to participate. Let's make some kind of a deal that addresses the growler issue, that doesn't expand retail establishments, and end up hurting all our little small-town liquor stores. And a lot of us have munis that are potentially impacted if all of a sudden six-packs start going down out on the street from the breweries. So there's a deal to be made, Senator Housley. I'd be happy to continue to be engaged on it, but the two sides have to be willing to get together and have a conversation about what the real intent of moving the barrel cap up is.
Further discussion on the bill, Senator Bigham.
Thank you, Mr. President. I have the A14 amendment.
Senator Bigham offers the A14 amendment. The Secretary will report the Bigham amendment.
Senator Bigham moves to amend Senate File Number 2130 as follows, page 1 after line 6, insert. This is the A14 amendment.
Senator Bigham, to your amendment.
Thank you, Mr. President. You know, another conversation that has to happen is about how we continue to support our small businesses and our local liquor stores that are not the big chains that I think benefited most out of the Sunday sales issue that came across a couple years ago. And that bill was promoted not only as a big revenue generator for the state, which turned out to not be true, but also about convenience for our customers and for small businesses. And one thing that we can do that I've spoke to the small liquor stores in my district, and they really know their business. And the one thing that they've asked is that we adjust the hours on Sundays. Right now, the hours on Sundays are 11 a.m. until 6 p.m. And we all know when it's Sunday and you're going to go tailgate out at the Vikings game at US Bank Stadium, especially if you live in my area or maybe out in Senator House's area, it takes a little bit of time to get out there. Game starts at noon. So you can't wait till 11 to pick up your cold brew, right? And so all we're simply asking is, can the stores open at 10 a.m. to allow for that convenience for that customer, but also to help, our small businesses get some additional revenue. The other issue is, for clarifying purposes, that we shouldn't have delivery of product to on sale as well. This does include that in this amendment. And more importantly, this last piece, I think, is just so common sense to help our customers, because again, this is all about the customers, is adjusting the holiday hours for Christmas Eve and New Year's Eve when they fall on Sundays. So simply put, this says that from 8 a.m. to 5 p.m., if Christmas Eve falls on a Sunday, 10 a.m. to 10 p.m. If New Year's Eve falls on a Sunday, the hours would be adjusted. And again, I speak to these business owners and the small liquor store owners, and their two busiest days of the year, Mr. President, are Christmas Eve and New Year's Eve. And so we really just need to help these small business owners and our customers. But you know what, Mr. President, I know that Chairman Dames does not like this amendment, because I've had the pleasure of speaking with him a few times about it. And I really just would appreciate a hearing. The public deserves an opportunity to come in to the Senate and hear these bills. And so I'm going to withdraw the amendment, because I know he's going to object to it. And there's some good provisions from my fellow members here that I know are important to them. So with that, I'll withdraw it, but I do hope that next year we can get a hearing on this, and it is alive and well in the House, and so maybe my wishes will come true and it'll miraculously appear in an omnibus bill coming over from the House. But with that, I will withdraw the A14 amendment.
Senator Bigham withdraws the A14 amendment. Members, we're back on Senate File 2130. Any further discussion? Senator Simonson.
Thank you, Mr. President, members. This is a fascinating section of law that always seems to generate very interesting debate. I remember when I first was elected to the other body, one of the things that they first tell you is that there are certain things that are considered to be third rail that you just don't talk about, and you don't offer as amendments, or you don't bring forward unless you have consensus among particular groups. And I think the discussion that we just had about Senator Housley's amendment is one example of that. And I would lend my voice to you, Senator Housley, along with Senator Bach, that I think that there is opportunity that we can correct this and fix this and find a solution before the end of session. And I would just offer you that I would be willing to help with that if I can in any way. Clearly, I have friends on both sides of this issue. Certainly, there is a small business located in Duluth that would be affected by the amendment that you withdrew. So I hope that as we go forward, we can maybe find a solution yet with the time that we have left. But members, there are often times where many of us will stand up and offer suggestions or ideas in the process on behalf of constituents with the hope that maybe we can convince folks that it's a good idea and that it is not controversial, and with the hope that we can do something good for somebody back home. So with that, Mr. President, I would offer the A16 amendment.
Senator Simonson offers the A16 amendment. The Secretary will report the Simonson amendment.
Senator Simonson moves to amend Senate File 2130 as follows. Page 1 after line 6, insert. This is the A16 amendment.
To your amendment, Senator Simonson.
Thank you, Mr. President and members. So back in Duluth, I've got a small business that is trying to manufacture hard apple cider. And under the current law, it's very challenging for them to do this because under the current law, they are mandated to manufacture it with Minnesota-grown agricultural products, which is a good idea. I concur with that. I agree with that. I think it makes sense. But this individual wants to make hard apple cider year-round. And you can't find Minnesota-grown apples year-round. On a good year, you might get it, somewhere between 2 and 4 months out of the year, but the rest of the year it's simply not available. So the A16 amendment does a couple of things. Number one, it defines what hard cider is. It's simply a beverage that may contain carbonation and flavors produced through the normal alcoholic fermentation of any fruit or fruit juice, 0.5%, but not greater than 8.5% by alcohol by volume. And it says simply that a licensed manufacturer of wine may sell at on or off sale hard cider if it uses Minnesota-grown agricultural products when available. So essentially, members, this individual, this business, a small business in Duluth would be able to offer this product, manufacture and offer this product using Minnesota-grown apples when they're available. And the rest of the 8 months out of the year when it's not available, it gives them the opportunity to continue to manufacture and offer this product for sale. So I think it goes a long way towards recognizing our Minnesota agricultural growers, and it goes a long way towards helping a small business, and I would hope for a green vote.
Discussion on the A16 amendment, Senator Dames.
Thank you, Mr. President. And I think there are some issues with this amendment when we say in the amendment it states that if Minnesota-grown products are not available, and I think we have to have some clarity and stuff as to what the availability, what we mean by availability. One person's opinion of what's available versus another could be very different. So until some of those things would be worked out, and I think that could be done down the road here, but I would speak against this amendment.
Further discussion, Senator Simonson.
Thank you, Mr. President. Thank you, Senator Dames. I don't disagree with you, and I think we're trying to kind of do this on the fly here a little bit, but trying to read a little bit into what you're saying, I think that at least you're open to the discussion, and I certainly appreciate that. And I want to be able to make sure that if we do consider something, that we do get it right. So we'll continue to work on that. I think it's a good discussion that we can have. I don't necessarily think the underlying concept is controversial. So with that, Mr. President, I will withdraw the amendment for now.
Senator Simonson withdraws the A16 amendment. We're back on the bill. Any further discussion? See no further discussion, the Secretary will give Senate File 2130 its third reading.
Senate File number 2130, a bill for an act relating to liquor.
Third reading. Senator Osmek.
Thank you, Mr. President. Just in closing comment, I appreciate what Senator Bach had to say. I know he's not on the floor right now, but the Craft Brewery Guild has been here all session, asking for a conversation. And in the comments that Senator Bach made, I hope that no from the other side is not the negotiation position. We need to continue to look at this, and just say no might work in Washington, D.C., but it just say no doesn't work in the Minnesota Senate. And I think we do have a lot of room for growth in Minnesota on the craft brewery area. This is not something to be ignored. It is small businesses. I hope that both sides will work together, and I would be happy to be involved in that conversation. But just say no is not going to be the answer. Otherwise, next year we'll be here again with the same conversation. Thank you, Mr. President.
Further discussion on Senate File 2130. Senator Dames.
Well, thank you, Mr. President, and I did appreciate the Senator Bach's comments, and I know that there has been some negotiations going on, but that seemed to have stopped here in the last 2 weeks, so hopefully maybe we can get both sides back to the table and see what we can come up with. I know last time this issue was worked on, it was about a 2-year process before we actually got the agreement on the 20,000 barrels. And so this might take some time, but we just need to encourage people to keep moving forward and keep working with it. So with that said, I would ask for a green vote on the bill.
Members, we're on final passage of Senate File 2130 as amended. Any further discussion? Seeing none, the Secretary will take the roll. All senators having voted who have the desire to vote, the Secretary will close the roll. There being 57 ayes and 10 nays, the bill is passed and its title agreed to. Members, we will revert back to the fifth order of business, reports of committee. Senator Gazelka.
Mr. President, move that the committee reports printed in the addendum be adopted.
On the adoption of the committee reports, all those in favor say aye. Opposed say no. Motion prevails. Continuing under motions and resolutions, Senator Pappas.
I move that Senate Bill 2279 be withdrawn from a committee on taxes and re-referred to the Committee on Judiciary and Public Safety, Finance, and Policy.
Senator Pappas, this is your bill, and have you...
Thank you, Mr. President. Yes, this was a mistake in the President's office, Mr. President. It was sent to the wrong committee. It really belongs in Judiciary. It's nothing whatsoever to do with taxes.
All right. Our apologies, Senator Pappas.
Thank you, Mr. President.
On the Pappas motion, all those in favor say aye. Opposed say no. Motion prevails. Members will move to the 13th order of business, announcements of Senate interest. Are there any announcements of Senate interest? Senator Gazelka.
Mr. President, move the Senate do now adjourn until Monday, April 8th at 11 a.m.
Senator Gazelka moves that the Senate do now adjourn until Monday, April 8th, 2019 at 11 a.m. All those in favor say aye. Opposed say no. Motion prevails. The Senate is adjourned.